Hello, everyone. So before we get started, does anybody have any questions about anything we went over last week? Or Monday, excuse me, not last week. It seems like last week. It was just 2 days ago. No? Okay. So we kind of ended right there at the mandibular, the premolars. So we are, let me make sure I have right. Nope. I want to start with the maxillary premolars. Sorry, not the mandibular. Let's try this again. All right, so this is coming straight out of chapter 17. So this is our mandibular posterior teeth, and our posterior teeth in general. Not we're going to start with maxillary and then go over to the mandibular. So maxillary first premolars are tooth number 15 and number 12. This is a this is the buccal, the lingual, the mesial, the distal, and the occlusal surface. You can see that the maxillary first premolar has one single root. We're going to kind of talk about that. You can see that it has two different cusps. We're going to discuss that. We're going to kind of go into detail about all of those. So let's go ahead and talk about the specific overall features of the maxillary premolar, first premolars. So they erupt between the ages of 10 and 11 years old with a root completion at 12 to 13. These teeth erupt distal to the primary maxillary canines or their arch space. So it depends on if the premolar or the canine is missing or not, and are succedaneous replacements for the primary first molar. Okay. The crown of the first premolar has an angular shape with sharp outlines compared with the maxillary second premolar, which have a more rounded shape, and you'll be able to see those with a comparison later. The two cusps are also sharply defined, and with the buccal cusp usually about 1 millimeter higher or longer than the lingual cusp. So the buccal cusp is a little bit longer than the lingual cusp. And you can see that on this image here from the lingual version, that the cusp is a little bit shorter by about 1 millimeter. Okay. So looking at the root, the most maxillary first premolars are bifurcated at the very, very tip, and branches in the apical third. So it's that, as you can see here, it goes in this direction. This is that that apical third, whereas this is that middle third. Here's the cervical third. So it starts to branch really high up. You're going to see, you see here that there are some concavities, and on the mesial, it kind of goes all the way down into the depression kind of goes all the way into the crown as well. So when you are feeling with an explorer or a probe in that area, you're going to kind of feel a little bit of a depression when you're feeling those teeth. The root trunk usually makes up half of the length of the entire root. I mean, it does, to me, it looks like it takes up almost 2/3, but it says half here in the book. And then the roots are rounded overall and tapered sharply towards the apices. All right, so here's the pulp cavity. The pulp cavity for the 2-rooted tooth usually shows pulp horns for each of the cusps. So whether it's a 4-cusp tooth or a 2-cusp tooth, it will have the amount of pulp horns for the amount of cusps. And although it has 2 pulp horns, 1 for each cusp, it has 2 canals as well because it bifurcates up at the top. All right, so let's look at the buccal of this tooth. The crown is the widest, mesial to distally, of all premolars, and this tooth's crown is wide at the level of the contact area, and then becoming narrower at the CEJ. I think you guys drew premolars last week, and you probably can, you have that, just like the cuspid we talked about the other day. It is widest here, and then it narrows in towards the CEJ. The mesial and the distal outlines of the crown are almost straight from the contact areas to the CEJ, but the mesial outline is a little more rounded. And then this tooth is the only tooth in the permanent dentition that has a buccal cusp with the mesial cusp slope longer than the distal cusp slope. So here's the mesial cusp slope here, and then here's the distal cusp slope here. So the mesial cusp slope is longer than the distal cusp slope, which helps distinguish the right from the left. So if you were looking at 2, you're looking at the way that the slope is on the mesial and the distal to help determine which tooth it is. All right, looking at the lingual features. The lingual surface is rounded in all directions, but is smaller than the buccal surface. And you can see here that you can see how wide the buccal surface is, whereas the lingual surface is a little more narrow. The shorter lingual cusp is sharp, but not as sharp as the buccal cusp, and is offset towards the mesial. All right, any questions so far? Okay, so now we're going to look at each of the proximal sides. Who can tell me what is meant by proximal?
Proximal is like closest to, or like, do you mean like interproximal, like in between?
So they're the proximal surfaces. What is a proximal surface?
It's like the touch.
It's either the mesial or the distal. Those are your proximal surfaces. Does everybody understand that? So yes, we call them interproximal, but I'm sorry. I know that Amanda's trying to get in. It keeps I don't know if it's kicking her out or, okay. So when we talk about the proximal view, that means we're talking about either the mesial or the distal view of a tooth, okay? On the mesial surface, the mesial marginal ridge is present on the concaved occlusal margin. So there is a ridge on there on the margin by the occlusal, by the occlusal. And then the mesial marginal groove is also present. So you can see that little groove there that is present on the, can you guys see me pointing? No. Okay, I gotta go up here. How about here? Yes, okay. So you see the little groove here. So here's the mesial marginal ridge right here. And then here's the marginal groove, the mesial marginal groove. The mesial surface usually also has a mesial developmental depression located cervically to the contact area. Across the CEJ, so the mesial surface usually also has a mesial developmental depression, and that is what this depression is right here, okay? Located cervical to the contact area. Here's where your contact area is. Here's where your cervical line is, so it's going to be cervical. And then it normally extends into the root. On the root, the mesial developmental depression joins a deep linear developmental depression and the mesial root concavity on the root trunk. So that would be all of this right here, okay? Extending from the contact area to all the way into the bifurcation, okay? Switch. Okay, this is better. All right. So all of these mesial features help to distinguish the right side from the left side, right? So if we are holding that tooth in our hand, and I'm going to bring the teeth again on Monday so that we can really get a good idea for the way that the teeth look. And when you're looking at, looking at these, when you're looking at the first premolar, you want to look for that depression on the roots, on the mesial, cervical to the contact, so that you can determine whether it's a right tooth or a left tooth. Okay. On the distal surface, you can see right here, it doesn't have that depression. And even though there is a depression in the root, it certainly doesn't start on the distal surface. So although it's similar, the depression is not there. More of the occlusal surface is shown because of the distal marginal ridge is more cervically located. So you can see that the distal marginal ridge comes up a little bit. So it's not, whereas like here you can't see that much of the occlusal because the mesial marginal ridge is covering it on the other side, that distal. And then here's your comparison of the two. Like I said before, here is your, on the mesial, you're going to have that depression. Although you have the depression on the distal, it's not as prominent and it doesn't go down into the crown of the tooth. Any questions about the buccal, lingual, or the proximal surfaces of the premolar? All right, so let's go ahead and take a good look at this occlusion. So this is looking at the biting surface of the tooth. The outline of the occlusion somewhat is hexagonal or six-sided and is wider buccal to lingual than it is mesial to distal. Okay, you can see that. It's kind of a longer tooth this way and then wider that way. Here's your occlusal table, and there are lots of components. So, let's start with the image over here on the left. So here is your distal cusp ridge of the buccal cusp. So this is the buccal cusp. So distal cusp ridge. And then you have your lingual cusp ridge of the distal, of the buccal cusp. okay? Mesial cusp ridge of the buccal cusp, and then your buccal cusp ridge. So those are your ridges. And then you have your central groove, which goes through all, all the molars have, premolars and molars have a central groove. Your mesial marginal groove runs over the mesial marginal ridge, okay? And then we have two pits. You can see here, this is the mesial pit, and then this is the distal pit. Shaded in blue over here on this right is your distal, so this is your distal marginal ridge here, and then your distobuccal triangular groove. Here's your mesial marginal ridge, right? Here's your mesial marginal groove, which we already discussed. And then you have your mesiobuccal triangular groove. So it's hard to see from this angle, but you have your mesial, your mesial and your distal ridges and they all come together to make that cusp, right? And so those kind of valleys are what we call our triangular grooves, okay? And then we have our transverse ridge, which runs, it's our buccal triangular ridge and our lingual triangular ridge, right? So, which are also the lingual cusp ridge and for the buccal cusp. So this has two names. This has a buccal triangular cusp as well as the lingual cusp ridge of the buccal cusp. I know that there is a lot of components of the occlusal surfaces and the occlusal tables, but hopefully your homework helps to, kind of put that into a little bit more perspective than me just, pointing out everything to you. All right, so any questions about the permanent maxillary first molars? Anything that you read, anything that I just said that you don't understand? Okay, then I will be moving on. Moving on to the permanent maxillary second premolars. These are in the universal numbers. This is number 4 and number 13. For the permanent maxillary first molars, it was 5 and 12. So 4 and 13 are your maxillary second premolars. All right, so I think I may have put the same image on both, but I think I put the same image for both second and first, but you see that the first has the bifurcated, right? Everybody understand that? I know you can write an email to somebody about that later. Okay, everybody understand that there's a bifurcated root for the first one. Second one is a singular root. Okay, got it. Thank you. All right, so specific overall features for this. They erupt between 10 and 12 years of age with a root completion between the ages of 12 and 14. These teeth erupt distal to the permanent maxillary first molars and thus are also succedaneous replacements for primary teeth, specifically the maxillary second molars. The crown of the second premolar, the maxillary second premolar, resembles the first premolar, except for its crown is less angular and more rounded. And I think we discussed that just a few seconds ago when we were comparing a second ago. Additionally, more crown variations are with this one, especially on the occlusal surface. The occlusal surface anatomy, and they're noted in this tooth as compared to the maxillary first premolars. There are different shapes for these. So unlike the maxillary first premolar, which is bifurcated, this one has one root. The dimensions between it and the first premolars are usually about the same overall, except for the greater root length of the second premolar. The mesial concavity is not as pronounced on, although they have one, it's not as pronounced on the second premolar as it is on the first premolar. The pulp cavity of this tooth has 2 pulp horns and 1 pulp canal. The other one had 2 pulp horns and 2 root canal or pulp canals. All right, so looking at the buccal view. The buccal view is neither as long nor as sharp as the maxillary first premolar. All other features of the buccal surface are similar to those of the first. Looking back at this, here are your little pericymata. Remember, we can get those on our premolars and our cuspids. You can see again that we are narrow up at the CEJ and wider at our contact areas. And that this line is pretty straight from the buccal aspect of it. Looking at the lingual, all lingual surface features are very similar to the maxillary first premolar. The buccal is wider. It kind of tapers towards the lingual here. One exception is that the lingual cusp is a little bit larger, almost the same. Yeah, it's almost the same height as the buccal cusp. They're more parallel, whereas with the first premolar, it was 1 millimeter off. The lingual cusp is also slightly displaced to the mesial, which helps distinguish right from left as well. All right, looking at the proximal surfaces. The mesial surface is similar to that of the maxillary first premolar, except that the cusps are closer to having the same size, and there's no mesial developmental depression that is present on the crown and the root. Instead, the area, this area is cervical to the contact is more round. So you can see that it doesn't have that shallow depression, and the concavity is right here in the root, and it's not nearly as deep. So, all right, looking at the occlusal. The outline of the occlusal surface is more round. It's larger overall than that of the maxillary first premolar from the occlusal view. Thus, the hexagonal outline of the crown from the occlusal is more difficult to see. All right. Again, we have our central groove, which is a little bit shorter than the maxillary first premolar. And thus, when the groove ends in the mesial pit and the distal pit, at each of its ends, the pits are closer together and more in the middle of the occlusal table. So you can see here, here's your distal pit, here's your mesial pit. You have some supplemental grooves, but the mesial, there's no mesial groove that goes over that mesial ridge, right? All right.
Do you have a side-by-side picture for the second?
Of the first and second, I can certainly show you one.
Of like the occlusal view.
Yes.
Is the facial surface like less prominent on the second?
Yes, it's more round, whereas that buccal, you know, you kind of have that buccal ridge on the first, and you'll see it in a minute whenever I show you this, but I want to make sure I can. Okay, do you see this? So here's your first and here's your second. You can see that here it's got the buckle has a little bit more rounding. This is more round rather than this one has that hexagonal, much more hexagon shape than this one. Although it's still the hexagon shape, it's just not as prominent. Does this help, Bree? Okay. And you can see that the biting surface, it just doesn't have like the deepness of the groove as the first one. Okay. I love that. Second section. All right, so here is, we're going to go in with the permanent mandibular first premolars. So we have 21 and 28, which is your first, okay? Here is a picture of it. Here's your buccal surface, here's your lingual surface, your distal, your mesial, and then your occlusal. You can see here.
No, it's not showing on this screen.
Am I not sharing? Okay, there we go. Is this better? All right. Okay, yes, you can see it now? Okay, all right, so here's your permanent, well, I'll go back. 21 and 28, mandibular first premolars. All right, so this is your buccal, your lingual, your distal, and your mesial, and then here's your occlusal. You can already see that there is a little groove here on the mesial side. All right, so specific overall features of the mandibular first premolars. They erupt during the ages of 10 and 12 with a root completion of 12 to 13. They erupt distal to the permanent mandibular canines, because those canines usually are in first, and thus are succedaneous replacements of the primary first mandibular first molars. They resemble the mandibular canine in many more ways than it does the mandibular second premolar. So the mandibular first looks a lot more like a canine than it does a premolar. All right, so let's go ahead and look at the crown. It has a buccal cusp that is long and sharp, and you can see that here, and is the only functional cusp during occlusion. So that's when your teeth come together. That's what occlusion is, which is similar to the mandibular canine. The lingual cusp is usually small and non-functioning at all, and you can kind of see that cusp there. All right, looking at the root, it has a smaller and shorter root than does a mandibular second premolar, although it is closer to the length of a second premolar than it is the mandibular canine. Looking at our pulp cavity, because of the fact that it has the two cusps, it has 2 pulp horns and 1 pulp canal, and each pulp horn is located within the cusp. The outline of the crown, looking at it from the buccal, is nearly symmetrical. In contrast, the buccal ridge is not as prominent as the maxillary first premolar. The buccal cusp is also located slightly to the mesial of the center of the crown. And again, similar to the mandibular canine. So here is that buccal cusp, and it is slightly to the mesial, but it's still pretty much center. Thus, the 2 cusp slopes of the premolar are not equal in length. So because it goes over, they look equal, but it looks like the distal is a little bit longer than the mesial because of the way that buccal cusp slightly goes to the mesial. It's going to make that mesial slope a little shorter. All right, the mesial cusp slope of the buccal is shorter than the distal cusp slope, which helps to distinguish the right from the left. The distal outline is rounder and shorter. So let's see here, a little rounder and a little shorter, whereas this one's a little longer. All right, looking at the lingual view. This surface is much narrower than the buccal, with the crown tapered at the lingual. So you can see that it's kind of tapered back here because it's bigger in the front and it kind of tapers to the back. Most of the mesial and distal surfaces, therefore, can be seen from the lingual, which you can see that, right? This is the lingual view. Here's the mesial, here's the distal, and here's the buccal cusp. Because the lingual cusp is so small, most of the occlusal surfaces can be seen from this view. The lingual cusp lines up with the buccal triangular ridge. So here is the buccal triangular ridge here. And then this is your distal fossa. Here's your cusp. Here's your mesiolingual ridge because, your mesiolingual groove, because it tapers towards the lingual and doesn't just go over. It's a mesiolingual groove. You have your mesial marginal ridge, your distal marginal ridge will be over here, and then your mesial fossa will be over on this side, whereas your distal fossa is here. All right, a developmental groove, the mesiolingual groove right here, usually separates the mesial marginal ridge from the mesial cusp slope of the smaller ridge, of the smaller cusp. All right, any questions so far? Okay. All right, so looking at the mandibular mandibular first premolar from the mesial aspect. From the mesial, the crown tilts noticeably towards the lingual. So you can see that it kind of, it tilts this way. It tilts this way, all right? As do all mandibular posteriors. So from here to this, they kind of go up towards and tilt back. The buccal outline is longer than the lingual outline. So here's longer, a little shorter. Okay, the lingual cusp tip, which is this little tip right here, is usually in line vertically with the lingual surface of the cervical part of the root. So right here is what it's saying. So here is that cervical part of the root, and that cusp tip usually lines up perfectly with that. Do you see that? Okay. The CEJ curvature, that's this right here, is also more occlusal on the mesial surface. The mesiolingual groove, again, can be seen near the lingual margin. And then both the mesial surfaces, both of these mesial surface features help to determine whether it's right or a left tooth. All right. So when you are looking at a first premolar, a mandibular first premolar, and you are holding it in your hand and you're looking at the buccal of it, okay? Or actually you're looking at the lingual of it, okay? And you see the mesial groove on the right side of it. Can somebody tell me what tooth it is? If you're looking at it from the lingual, so you're looking at it from this angle, right? And you're seeing the mesial groove over on this side, because it's, which tooth would that be? Anybody like to guess?
28.
Nice try. 28 is a first premolar.
21.
21, yes. Because this would be 28 because this is the mesial. So if it was on this side, it would be 21. Do you understand that? That was you, Bree, that answered first, right? Okay.
Yeah.
All right. Okay, cool. All right. All right, so we did this. Looking from the distal side, okay? So here's our distal ridge here. There's no extra groove. Here's our CEJ. Here's our cusp tip of the lingual, and it still lines up great with that, up at the cervical part of the root. So the distal view is somewhat similar to the mesial, except it does not have the groove, that lingual, that mesial lingual groove, because we're looking at the distal, right? The distal marginal ridge, which is here, is more developed than on the mesial, because you can see on the mesial, you can almost see into it a little bit, right? Whereas the distal, it almost kind of covers it up a little bit. You can't see into the occlusal. And its continuity is unbroken by any deep developmental grooves. So there's no deep groove, there's no grooves that you can see there to kind of peek in to the, like you're trying to look into something almost. Does that make sense? Looking at the two. Like here, it's almost like you can see this groove. You can see that there's probably a groove over there from the mesial aspect, but from the distal aspect, you almost can't see in. It's like everything is a little hidden. These are the way that it makes me remember things. So if you come up with something else, please let everyone know, please share. Okay, so here is your difference on your comparison of the proximal view, right? So you have your mesial on the left and you have your distal on the right. You can see with the comparison of the two, what I'm talking about, right? Like this one, the CEJ is a little bit more curved than over here on the distal. You have the ridge. The ridge is the thing that I think is the, on both, for, when we were talking about those premolars, that either the mesial marginal ridge or the mesiolingual groove here. I mean, yeah, the grooves. Those are going to be the things that help you determine whether it's a right tooth or a left tooth. All right, so occlusal view features. So this is looking here at the nice occlusal. There's that mesiolingual groove. Here's your little pits, your mesial and distal pit. So the crown outline is diamond shaped, and you can see that here. Okay. And from the occlusal view, with a notch in the mesial outline, obviously right here of the mesiolingual groove, right? So the prominent buccal ridge is located on the buccal margin. So here's that prominent buccal ridge, right here. The lingual margin is much shorter than the buccal outline. And then the mesial margin is slightly rounded to nearly straight, except in the area near the groove. So it's nearly straight and rounded, whereas like there's that little divot there. So, all right, talking about the occlusal table components of the first mandibular first premolar. Both the cusp and the transverse ridge are offset to the mesial. So when you're looking at it with the buccal up, it is going to be towards the mesial, leaving the distal part of the tooth larger than the mesial part. Can you see that from here? So you see that like the mesial part looks a little less than the distal part, because everything is a little offset to that mesial. The mesial fossa and the distal fossa and associated mesial pit and distal pit are also found on the occlusal table. The mesial fossa is shallower than the distal, and although both are circular, the mesial fossa is slightly more linear. And there's a picture here. So here is our buccal cusp here, right? And then here's our triangular ridge. So this is what gives that, that from the buccal to the, from the occlusal, that triangular. Here's our central groove, mesiolingual groove. There's our buccal cusp. And here's our lingual triangular ridge here, okay? Now, when you come into the occlusal table portion of it, you have your mesiobuccal triangular groove, which is that little groove right there. And then your distobuccal, because it runs, it's either on the mesial or the distal of the occlusal surface, and it runs towards the buccal, right? And then you have your mesiolingual groove, but where the mesiobuccal triangular groove and the mesiolingual groove meet, you end up with your mesial pit, right? Hold on. understood. Technology. Okay, and so over here we have our distobuccal triangular groove, and then we have our distolingual triangular groove, although small, doesn't break the distal ridge, right? And then where that, the distolingual triangular groove, the distobuccal triangular groove, and then the distal marginal groove meet is where you get your distal pit. And then there's the central groove that runs in between the two pits. Okay, any questions about the mandibular first premolar? All right, moving on to the permanent second premolars, the permanent mandibular second premolars. This is tooth number 20 and tooth number 29. All right, so here is our mandibular second premolar. All right, so they erupt between the ages of 11 and 12 with root completion at 13 to 14. These teeth erupt distally to the mandibular first premolars and are also succedaneous because they replace, does anybody want to say it? All together now. I know, this is why I hate Zoom, but it's right there. Which teeth does this replace?
Second molar.
The what one?
The primary mandibular.
Thank you. All right. All right, so the mandibular second premolar crown. There are two forms. So the maxillary first, the maxillary second, and the mandibular first all have one crown type. For the mandibular second premolars, there are two potential types. One is a three-cusp type or a tricuspidated form, and then the second is a two-cuspid, which is bicuspidated form. Okay, so you can see here that one is more of a Y shape, and one is more of an H shape or a U shape. But do you see because of this groove here, it ends up having three cusps instead of just two. Okay. I'll tell you a little. My first premolars have two cusps on the back. It has a groove down the middle, whereas my second does not. So they didn't put that in the book. All right. So mandibular second premolar crown, the three cusp and the two cusp type. Unlike the mandibular first premolars, the more common 55% frequency three cusp type has three cusps with one large buccal cusp and two smaller lingual cusps. But similar to the mandibular first premolar, the less common 45%, I mean, that's like 50-50, right? 45 and 55, it's like pretty close. Two cusp type has a larger buccal cusp and a single smaller lingual cusp. All right, so the crown, there are two types of, two types of this tooth differ mainly on the occlusal features, but other surface features are similar. Both types of the mandibular second premolar have more supplemental grooves than the first premolar of the same arch. And the three cusp type also appears more angular from the occlusal view. And the second, or the two cusp type, appears more rounded. Did we lose Mary Beth again? Yes. Okay. All right. So looking at the root of this tooth, it is a single root, and it is larger and longer than the first premolar, but shorter than that of both types of maxillary premolars. So it's shorter than the maxillary premolar root, but it's longer than the first premolar on the mandibular. All right, proximal root concavities are pronounced. All right. So here's your proximal root concavities here on the mesial and here on the distal. Wait and see if Mary Beth comes back. Okay, so mandibular second premolar pulp cavity. The pulp cavity of the 3 cusp type has how many pulp horns?
3.
Good. And then the 2 cusp type has
2.
2. Good. But still only 1 canal because there's only 1 root, right? Okay. All right, so looking at the buccal, it has a shorter buccal cusp than the mandibular first premolar. The cusp slopes of the buccal cusp are also more rounded. So these are more rounded. It's rather than this being, everything is rounded rather than very angular and sharp like the rest of them. Looking at the lingual, from this view, it shows considerable differences from the first premolar. The lingual cusp or cusps, depending on the type, are a little bit longer. So instead of it being a shallow, they're a little closer in length. Thus, less of the occlusal surface can be seen from the lingual. And then because the lingual cusp is still smaller than the buccal cusp, however, the small part of the buccal margin of the occlusal surface may be seen. So because the lingual cusp is still smaller than the buccal cusp, you can still see a small part of the occlusal surface, which you can see here. All right, so let's talk about the lingual view on the 3 cusp type, okay? So in the 3 cusp type, there is a mesiolingual cusp, and then there is a, let's make sure. Okay. Sorry guys, Mary Beth has been kicked out from internet, so I keep wanting to check and make sure she's okay, or she hasn't tried to check back in. Okay, so the mesiolingual cusp is wider and longer than the distal lingual cusp. So mesiolingual cusp is here, distal lingual cusp is here, right? So this one's wider than the other. A developmental groove, the lingual groove, which is in between the 2 cusps, is located in between the 2 cusps, extending a short distance on the lingual surface and usually distal to the center of the crown because the mesiolingual cusp is wider. So because this one's wider, it offsets that groove to be a little bit more to the distal. Okay, does that make sense? Ms. Calhoun, none of this makes sense. It's a lot. I understand. It really is. And it's a lot of dental terminology. We really are learning a new language when we are talking about this because it's cusps and, you know, grooves and concavities, and it will all come together, but it's a lot of words right now. All right, so the 2 cusp type. With the 2 cusp type, the single lingual cusp development is at an equal height to the mesiolingual cusp. And it's the same as the mesiolingual cusp with the 3 type, but is higher than that of the first premolar. So instead of this being lower and that being higher, it's like I said, it's almost all to where it looks even, similar to like that first premolar on the maxillary. The 2 cusp type has no grooves noted lingually, but does show a distal lingual developmental depression where the lingual cusp ridge joins the distal marginal ridge. And you might be able to see that more on the distal view, which we haven't gotten to yet, okay? All right, so looking at the proximal view. From the mesial, it has a shorter buccal cusp. So when you're looking at it from the mesial, the buccal cusp is a little shorter and is located more to the buccal than the first premolar. Therefore, the distance between the cusp tips of this tooth is shorter than that of the first premolar. So the distance between the two cusps are different. And we already said that, right? So for the first premolar, cusp is a little high, the buccal cusp is higher, the lingual cusp is lower. Whereas for the second premolar, they're a little bit more even rather than this, okay? In addition, the crown is wider buccal to lingual than the lingual and the lingual cusp or cusps are larger. So it's almost like a more solid looking tooth rather than like that first premolar almost resembles a cuspid a lot, right? The distal view is similar, although more of the occlusal surface can be seen from this view because the distal marginal ridge is more cervically located than the mesial marginal ridge. And we're gonna look at pictures here. So the the distal view is similar, although more of the occlusal surface can be seen from this view. So more of the occlusal surface can be seen because the distal marginal ridge is more cervical than the mesial marginal ridge. So does everybody understand that? Here's the distal marginal ridge, and it dips down more towards the cervical margin than does the mesial marginal ridge. And that's how you can tell the right from the left, because there's no developmental. There is a little bit of that depression you can start to see rounding off here on the distal as well, which helps to determine the right from the left tooth. But, you know, comparatively, it looks like more of that distal marginal ridge would be the thing that you want to look for. All right, so the general shape of the crown outline is more clearly square. It is a more boxier tooth, you know, in compared to the first premolar, all the other premolars actually, especially the three cusp, which looks a little bit more square, and that's what this one is here. Actually, no, that one is not. Hold on. Yeah. Okay. This is just the two cusp, because here this doesn't go all the way across. The convergence of the mesial and distal margins toward the lingual is equally severe. So the margins are kind of equal. They're not the occlusal table. Everything is square. When square, it's equal, right? Okay, so the three cusp type grooves form a Y pattern, and remember the two cusp make a U pattern, or if sometimes, but less often, if the central groove is straighter, it looks more like an H. So I'm going to jump back to that other picture where we could see the two cusps. And here is your Y, your three cusp, right? Because of that, that distal lingual groove here, right? Or that lingual groove, sorry. And then this one's more U-shaped. Now, if this line was straighter and say the ridge wasn't as deep, that, you know, buccal ridge, if this was straighter, it would look more like an H. So that's another way you can determine, you know, what is, if you're looking at the occlusal surface. And there's the other picture. All right, so here's your lingual groove. This is your mesial lingual cusp, your distal lingual cusp. This is your Y-shaped, and your mesial marginal ridges are here. Your distal marginal ridges here. Here's your central. You have a central pit on the Y-shaped one because of the fact that the lingual groove comes and meets the central grooves, and then makes that pit in the middle. in the middle of the tooth. Whereas with the U shape, you have your distal pit, you have your central groove, and then you have your mesial pit. This one has a distal pit, your central groove, your mesial pit, for the Y shaped. For your, for your H shaped. For your Y shaped, it has 3 pits. Has anybody seen the snake eye fillings where you get 2 pits in the premolars? Like little snake eyes. They end up, you end up with decay here and here in the mesial pit and the distal pit, and they're little, like, they look like dice, 2 little snake eyes. All right. They're easier to see whenever they're put in amalgam rather than in white fillings, but when they're amalgam, they do. I think there's a picture in your book actually of the little. Yeah, look right there, 244. There's a picture of like on a first premolar. There's little pits. Okay. Moving on. Any questions about our premolars? Because we're going to move on to molars next. Which surface of the premolar is more common to have a groove that goes over the marginal ridge?
The mesial?
Good. Yes, the mesial. And it is the first and the, let me double check before I say the wrong thing. Yes, so the first premolar, maxillary first premolar has the mesial marginal ridge groove, and then the first mandibular has one as well. So, okay. And I will be putting these on canvas for you to see, as well as the one I did the other day. Okay, moving on to molars. All right, let's do this because we have, I can't even find you guys now. We've been at this for a whole hour. Let's go ahead and take a 5-minute break, get some water, go to the restroom, and I will see you back in 5. I'll record this one. I turned it off during our break. Gosh,
Can I have a
okay.
2-minute break to go to the bathroom?
Yes, sure. Thank you. Thank you for speaking up. All right. I'll get this ready while that's going on. My son had elementary school promotion. He's going to 6th grade. I'm having a very hard time with it today. I may have cried on occasion today, just because of the fact that I can't believe he's going to middle school. Okay, since I did not record the mandibular teeth, I will record it and then send it to you guys afterwards. I had turned the recording off during the break, and then when I came back to kind of save space, because it takes forever to, upload it. But I'll go ahead and make a PowerPoint recording for that. So if you guys want to refer back to it, you can. Okay. All right. Chapter 17. Okay, so primary dentition. This is it. We've learned about the central or the primary teeth, permanent anteriors. We've talked about the canines. We've talked about the premolars and the molars, and now we're going to talk about the primary dentition. It is not nearly as detailed as this is the entire dentition right here. It's not going to, we're not breaking it down. So, all right, primary dentition. This is a great picture. I kind of thought it was kind of cool where you can see baby teeth, permanent teeth starting to, grow in. Here's, am I not sharing? Thanks. I do this frequently. Thank you for sharing. Okay, now can you see what I'm talking about? The cool mouth I see? Okay. So you can see here, this is like the dentition, and then here are baby teeth. These are all the baby teeth. And these are the permanent teeth that are coming in underneath. And then these are the second molars, first molars. These are the third molars. And that's a third molar that is starting to develop. It's in the sac. And so it's starting to develop, which is cool. Okay. Tooth types and features. The first set of teeth is called the primary teeth or the primary dentition, right? The primary dentition is shed and replaced by the permanent dentition. There are 20 total primary teeth when the primary dentition is completed, 10 teeth per arch. They include incisors, canines, and molars. And they are designated with the universal numbering system as letters A through T. A through J, K through T. Formation and eruption properties. Mineralization of primary teeth begin in utero between 13 and 16 weeks. By the 18th to 20 weeks prenatally, all primary teeth have started to mineralize. There are usually no primary teeth visible in the oral cavity at birth. However, there are things called neonatal teeth, which they can be in there, but most of the time that is not the case. The first eruption of the primary tooth, a primary mandibular central incisor, occurs at an average age of 6 to 10 months, with the further eruption of the rest of the primary dentition following. The first eruption of a primary tooth, I totally copied that twice, sorry. Okay, moving on. Eruption properties. The actual dates are not as important as the eruption sequence because there's 6 to 10 months, that's a 4-month variation. And I know people who have had their, oh, well, my kid got their teeth in at 4 or 5 months. So there's a huge variation of when teeth can come in. The actual times of when they come in are not nearly as important as the eruption sequence because because of the variation in dates. But the sequence tends to be pretty uniform. You start by getting your central incisor, your mandibular centrals, then your maxillary centrals, then your maxillary laterals, then your mandibular laterals. Then you get your maxillary, then you jump in the back and get your first molar, first maxillary molar, mandibular first molar, and then your maxillary canine, mandibular canine, second molar, and then on the mandibular, and then second molar on the maxillary. So it kind of zigzags, but these, people always remember these, the molars, they swear take, it just kills the kids, but My kids always ran fever and drooled like a banshee. So, that's just what happened. Primary teeth features. Interproximal spaces between the primary teeth are present in most children because the space is necessary for proper alignment for the future permanent dentition. The spaces, which are usually on the maxillary in between the lateral incisor and the canine, and then on the mandibular, canine, and the first molar, where these little arrows are called proximal spaces, or primate spaces, primate spaces. And they're mainly involving spaces between, like I just said, the maxillary, lateral, and canine, and then on the mandibular, it's between the canine and the first molar. So those are called primate spaces. That will come up in another class, I promise. Primary to permanent comparison. I mean, look at the size difference of the permanent tooth and a primary tooth. Permanent teeth are twice the size of a baby tooth. So when there is no space, like I said the other day, it is very hard to get those permanent teeth in there without losing, without crowding, right? So you can also see here, one of the things is the widening of the roots. It's so that they can, the permanent tooth can grow here and not hit these and cause issues. So there's, they're much more, and you'll see in the molars how they're much wider root, the roots are wider rather than closer together.
Question.
Oh, yes.
Yeah, so when the permanent teeth, they're coming to replace the, when the permanent teeth are coming to replace the primary teeth, does it cause the gums to kind of recede or something like that because they are much larger? I don't know if the word is recede, but like as if the gums are too small or...
They're more, to me, they're more flat. They're not as deep because of the fact that it takes time for you to get that nice cervical curvature in the gingival margin. Is that what you're saying?
Yeah, so
Yeah,
when
like,
it looks as if the gums are receding, but it's not like they're receding, just like that tooth is still like taking shape, like expanding or something like that.
Yes, it's still forming, and you, so that being said, say someone's missing their lateral incisors, and I don't know if any of you guys have ever dealt with a patient like this, but say someone's missing their lateral incisors, and orthodontics does everything and keeps everything nice and open to where the patient can get implants in those spaces. They won't do that on females until they're like 18 years old. Now, women usually stop growing at like 14, 15 years old, but they won't do that until they're 19 or 20. And for males, they won't do it until they're 20 or 21 because of the fact that they need their gums to get to that curvature, that curvature that they want. Because if not, it will be like the tissue won't be curved in that area. It won't make it look natural. Does that make sense? Because you have you kind of have to wait for everything to kind of like go into this nice, curvature around the CEJ once everything is matured. Matured is the best way to put it.
Oh,
because
okay.
like as the tooth erupts, like usually like say this is all covered by gum, right? And like only this, it's like straight. And then as the tooth comes in, it stays straight until it gets to here, but then the tissue has to kind of like go. It takes time for that to happen. Maybe it'd be better if I was drawing things on the board.
I get it.
Right? It's hard to explain, but we'll see some. I think I have some pictures in here of like the gingival margin never gets that nice curvature until we get older. That's my point. Okay. Safe to move on, anybody? All right, so yeah, like you can see the tissue here, like it's not gonna be fully curved like this until the tooth is fully erupted. And, you know, so this is your permanent and primary comparison. Your occlusal table in the primary is narrower than that of the permanent counterpart. You can see here, this is a permanent molar. This is a primary molar, and a primary canine. And then here's some permanent mandibular incisors. Some fungiform on your tongue. Everybody see that? And everything. All right, so the primary crown. The crown length, the crown of a primary tooth is shorter in relation. Again, look at the size difference. And its total length. The crowns are also more constricted or narrower at the CEJ, making them appear bulbous in comparison to the thicker neck. So it makes it's not as tapered than, or it's tapered rather than not as tapered on the mandibular, on the permanent crowns. Do you see that, how it kind of tapers in? So what it makes it look like is a bulbous crown with a thin neck, whereas this is like the neck is all the same size. The neck and the you can see here that it's got a whiter crown. This has got a yellower crown. It's smaller. Like look at the root trunk, it's smaller. It has a prominent cervical ridge. This one has much wider roots. These are narrower, but spaced out more. All right, primary teeth also have a wider tone of enamel on the crowns over permanent teeth because of the increased opacity of the enamel, which covers the underlying yellow dentin. So the enamel is more opaque than the enamel, than the permanent enamel. All right, so primary teeth roots. The roots of the primary teeth are narrower and longer than the crown length. Each crown to root ratio of the primary teeth is smaller than those ratios of their permanent dentition counterparts. Molar roots flare more as they approach the apex. The apical foramina may be larger, with the accessory canals often larger and more numerous. And remember, the apical foramina are where the nerves and stuff go in. The roots may also show partial resorption as the tooth begins to shed, which can be noted radiographically. So as the permanent tooth starts to erupt and the primary tooth starts to shed, the root will start to disintegrate. You can see the pulp chambers are relatively large in comparison to the permanent. You can see that the enamel is not nearly as thick as the permanent. And then there are usually, pulp horns, depending, for the molars, the cusps and stuff, just like a permanent tooth.
Question, please.
Yes.
So when the primary teeth when it sheds, does the root comes out with it, or just the crown?
Just the crown. I'll see. Let me see if I can find a radiograph real quick.
So what happens to the roots? Does it kind of like disintegrate, or?
Yes. Yeah, they dissolve. See. see if I can. It's not, hold on. Let me see if it's here. All right, can you see this? The radiograph? Yep, okay. So this, let's see. These are permanent teeth that are already there. And you see how half of the root is erupted? So these are just starting to come in because here's the bone. These are your your permanent lateral incisors that are in. And there's not much space, but you can see that the root here on the canine is starting to dissolve, as well as the root here on the first molar is. You can see the full root there. You can see the nice like capsule that the tooth is growing in. And you can see here that this tooth is starting to get like that root growing. So these will start to disintegrate, kind of like the ones up here. Lower teeth are always so much easier to see. Let me see if I can find another one. Okay, see this one. You can see the root on this one starting to dissolve as well. Like you see that tip right there, it's starting to come more and more up. And so it's dissolving that root. So what happens is something in our body, kind of like, when women go into labor, something in our body triggers and then we go into labor, right? And so with our mouth, the way that it works is something triggers that baby tooth to start to dissolve that it's time to go. And so then the permanent tooth is erupting, and it's because remember that permanent tooth starts growing, it's while the baby tooth is still growing. It's off of the primary tooth bell cap, bud stage. It comes all off of that. So off of that development. So it triggers like almost like the way it was described to me is like, it's like a flick, and like the tooth is like, oh, it's time to go, and so then it resorbs. Permanent tooth still is starting to come up as the root is resorbing until all that is left is the crown. So does that help?
Yeah.
Yeah. I mean, next time my kid gets a loose tooth, Gilbert, I'm going to send them to you.
Oh, I have some in the house.
Okay. That way, it's yeah. So, and every kid that I know who has a loose tooth, they call me to try to come. Miss Calhoun, can you come and get my kid's tooth out? No, I'm not coming to get your kid's tooth out. Let them wiggle it out themselves. Secretly, I'll have to take them out. Okay, so did that help answer your question?
It does, because I'm just imagining in my head, like if those roots resolves or they dissolve, I'm just wondering how the kids are eating all these things and they don't have any pain because there's barely any roots holding the,
Oh yeah,
yeah.
they don't have any, because like the pulp, so it'll get to a point where like the pulp dissolves, because the kids will come in and it'll just be a pink shell because it's completely resorbed. Everything on the inside is out. It is literally just enamel, just hanging on for dear life. It's cracked into a billion pieces, but they're one little piece, just they won't wiggle it out. You know, it's, my daughter will tell you to use an ice cube, numb the spot, and then twist it out. But she's an odd bird, that one. All right. So yeah, they don't have any pain. So that's the good part in it, right? I think I said all this. Yes, the pulp cavities, the pulp chambers are wider. Okay. All right. First cell appointment here. Mrs. Calhoun's going to get on her soapbox real quick. You know, I love to pull out that soapbox. Okay. The child's first dental appointment should occur within 6 months of the first eruption of the very first tooth, and no later than 12 months of age. So by 6 months, no later than 12. I mean, by 6 months after the tooth has erupted, and no later than 12 months of age. So if your child doesn't have any teeth at 12 months, it's a good idea to go in and have someone take a look. Okay. The intent of this recommendation is to provide information to the child's supervising adults. It is called anticipatory guidance, which will help to establish positive preventative behaviors, serious dental problems, and allied concerns. So it talks about non-nutritive habits such as finger sucking and pacifier. It talks about diet nutrition. There's like a whole guideline of information that parents should be getting. They should, as we talked the other day, if a child has, I think I said this to y'all, I might have said this to my other class, but if a child has, if their parents have high risk for tooth decay, it is really important that a child go to the dentist earlier rather than later. And that's why it's so important to get them in. It is important to keep the primary dentition healthy because of the fact that it holds a spot for the permanent teeth. If you lose a baby tooth early and you don't maintain the space, you can cause damage, like you can cause lack of space. Things will start to tilt and cause issues for permanent teeth that are going to be, that could be coming in. So you may or may not know someone who is writing their thesis about this topic right now. Just saying. Early childhood caries is a prolonged nighttime, and I don't like this either. It's bottle feeding and breastfeeding at night. It doesn't, because breast milk also has some type of sugar. It is a carbohydrate. It is supposed to keep you full, right? People who put sugar on pacifiers, that's a bad thing. We'll talk about the etiological factors of tooth decay. Hold on, my headphones are dying.
Hello. All right, can you guys hear me? Yes, okay. All right. So, if you put a child to bed with a bottle that has formula in it, or if you allow a child to on-demand feed throughout the night, you run the same risk once a tooth is erupted. And that risk is the more frequent you are snacking or eating or drinking, the higher risk you are of, because you're putting your mouth in a demineralized state and not having time to get back to a remineralized state. So it is important that we educate our parents about this topic. So because this is what can happen. It is called it used to be called baby bottle, baby bottle bottle rot or baby bottle decay, but it is it's now early childhood caries, and that's for any child under the age of 5 that has tooth decay. So but it's 20% of children under the age of 5 have tooth decay. That's just under 5. Okay. All right, special considerations for primary dentition. Child patients and supervising adults sometimes discount the importance of teeth of the primary dentition because they believe that they're temporarily and they're soon going to be replaced. I will teach you differently. However, these teeth also serve an important function of holding open the eruption space for the succedaneous teeth, which will replace the permanent teeth. Supervision of home care procedures must begin early. As soon as the first primary tooth erupts in the oral cavity to prevent premature loss of primary teeth. You will learn the steps and procedures to do this in the future. For right now, it is important that you know that it's good to care for them. All right, so the quick rundown of the primary teeth. So we have our primary maxillary central incisors. These are letters E and F. From the labial aspect, the crown appears wider from the mesial distal, than it is incisal to cervical. The opposite of its permanent successor. So usually it is longer rather than wider, right? Both proximal surfaces appear similar. You can see that from here to here. These are the two proximal surfaces. And it is a single root that is generally round in shape and tapers evenly at the apex, but it is longer relative to the crown length than the permanent central incisor. Okay. The lateral incisors, the maxillary lateral incisors, these are letters D and G. The crown is very similar to the central incisor and is much smaller than the central incisor in dimension. The lateral is also longer in size, incisor to cervical than it is mesial to distal, exactly the opposite of the central, right? It's similar, but it's opposite in length and width. The incisal edges are also more rounded than the central. So if we go back and look at the central is very sharp. The lateral is a little rounded. Okay. The root is also similar to that of the central, but the lateral root is longer in proportion to its crown compared with the same proportions of the central, and its apex is a little sharper. So a little bit longer and a little bit sharper. The mandibular central incisors are O and P. These are like teensy tiny. The crown looks more like the primary mandibular lateral incisor than its permanent successor or any other primary maxillary incisor. The tooth is also quite symmetrical, however, which is similar to the permanent. The permanent tooth is also very symmetrical, the central, if you remember from Monday. The lingual surface appears smooth and tapers towards the cingulum, which is back here. The root is a single long slender root, and labial and lingual surfaces of the root are rounded, but the proximal surfaces are slightly flattened. So these are flatter, and then they're rounded on the labial and the lingual. All right, lateral incisors on the mandible are N and Q. The crown is similar in form to the central incisor, but the crown is wider and longer than that of the central. So similar in form, but the central is much more narrow. This one's a little wider. The incisal ridge slopes towards the distal, and the distal incisal edge is more round. Okay. From the incisal aspect, the crown is not as symmetrical. So this is the incisal. See how there's like a dip? Because the cingulum is offset to the distal, which has the same cingulum position as the permanent lateral incisor. The root may have a distal curvature in its apical third, and it usually has a distal longitudinal groove. So on the distal, there's a long groove there, but you see how it kicks out towards the distal. This is an image of attrition in baby teeth. Dental professionals sometimes note excessive wear or attrition on the incisal edges or ridges of the primary incisors due to bruxism or grinding, and the possible formation of end-to-end bite. So again, we'll talk about occlusion next week, but end-to-end is when the molars bite cusp to cusp or the edges come together. All right, maxillary canines, CNH. The crown is relatively longer and sharper cusp than that of its permanent successor when first erupted. The mesial and distal outlines are rounded, however, they greatly overhang the cervical line. On the lingual surface, the cingulum is well developed, as are the lingual ridges and the marginal ridges. The lingual ridge extends from the cingulum to the cusp tip and divides the lingual surface into a shallow mesiolingual and distal lingual fossa. And then the root is twice as long as the crown and more slender than that of its permanent successor, and it is inclined distally. And here's a beautiful picture of it. So here are your fossas, right? So distal fossa, mesial fossa, you can see that they are much more rounder on those sides. And then you can see that it dips, because this is they always put right teeth in the mouth. They never put the left. So it dips towards the distal. All right, mandibular canines, M and R. The crown resembles that of the primary maxillary canine, although some dimensions are different. The tooth is smaller labio to lingual. The lingual surface is smaller than the primary maxillary canine and is marked by a shallow lingual fossa. The root is long and narrow and almost twice the length of the crown, although shorter and more tapered than that of the primary maxillary. So shorter and tapered, but still goes towards the distal. All right, on to our primary molars. There are 8 primary molars with 2 types, a first molar and a second molar. One of each type is located in each quadrant of both dental arches. Primary molars are replaced by permanent premolars when they shed. A prominent cervical ridge is present on the buccal surface, and the occlusal table of the primary molar is more constricted buccal lingual than the permanent molars. The roots of the molars are flared beyond the crown. Like I said earlier, they're widely separating the roots. Additional space is thus created between the roots for the developing permanent premolar crown. The primary molars have a short root trunk as with the permanent posterior teeth. The roots branch a short distance from the base of the crown. Again, this arrangement creates more space for the developing premolars. Maxillary are B and I for the first molars. The crown does not resemble any other crown of either dentition. The occlusal table has 4 cusps, mesiobuccal, mesiolingual, distal buccal, distal lingual, with 2 mesial cusps being the largest and the 2 distal cusps being quite small. You can see from here. It can also have only 3 cusps because the distal lingual cusps may be absent. Three root branches are thinner and have a greater flare than the permanent molar, and the root trunk is short. And it's got that flare so that the permanent premolars can erupt or, grow. A and J are the maxillary second molars. The tooth is larger than the primary maxillary first molar. It's almost like it's building. First one is a little small, second one's a little bigger, and then you get this ginormous, 6-year-old molar, your first molar, first permanent. This tooth most closely resembles the form of the permanent maxillary first molar, but is smaller in all dimensions. Thus, it usually has a cusp of Carabelli, and you can see it right there. The minor fifth cusp, as does its permanent counterpart, which is the first molar. All right, the mandibular first molars, L and S. This crown is unlike any other crown in either dentition. The tooth has a prominent buccal cervical ridge. So you can, cervical ridge is down here, prominent cervical ridge, which is also on the mesial half of the buccal surface, similar to other primary molars. The mesial lingual cusp is long and pointed and angled on the occlusal table. And the tooth has two roots, which are positioned similarly to those of other primary and permanent mandibular teeth. They have a little bit more of a flare, but you can see that they're straight and they're just the two roots as though they're standing. And then the primary mandibular second molars are K and T. This tooth is larger than the primary mandibular first molar. This tooth most closely resembles the permanent first molar, mandibular first molar, because it does have that fifth cusp of the distal cusp right there. The three buccal cusps are nearly equal in size, 1, 2, 3. And then, however, the primary mandibular second molar has an overall oval occlusal shape. So you see it's oval rather than, I think the other one was square. And that is it. One of the things I would like to mention about baby teeth and permanent teeth, especially in the molars, children end up gaining a little bit of space with their eruption of their premolars, because the baby molars are bigger, that are wider than the baby molars are wider than the premolars that are going to be coming in to take their place, right? So even the most crowded kid can sometimes gain a little bit of extra space in that area, which will be beneficial when those big, large canines come in after those little baby canines. I know this was a lot of information. Any questions about the teeth, the molars, the teeth, really, right? Anything that I went over that you guys have any questions about?
Is there going to be any I guess labeling or numbering on the exam, or it's going to be all describing
I
it?
haven't decided yet, because I did definitely think about doing some labeling because it was such a heavily labeled section. My plan after this is to look and start to make the exam for this. And so I will let you know if that is something you need to be focused on. I will let you know by tomorrow. Okay. I'm looking, let me,
Do you think there'll be practice questions like this is 232, but what would it be in the other?
there will be number questions like it, like that, for the numbering system. Yes. Let me see if I can, well, we know what we did all that the other day. Let's see. most of it, so like, okay, so here's an example. Like, because I think there are some questions about like teeth numbering systems. Like if it's tooth number 8 in the universal, what tooth number is it in international? Okay. And then if there will be a DAQT question on there. So if it's tooth number 23, what is the DAQT for it? So I'm gonna expect for you to say permanent mandibular left lateral incisor. Okay.
So you're not gonna ask anything with like the Palmer's method, because how would I know that's 23 and not 23?
And I could ask a Palmer method question if I say something like in the universal, it is in the universal numbering system, tooth number 8 is what in the Palmer's, and then it would be a multiple choice of the brackets. Yeah. Okay. Good questions. Good questions, you guys. Any so the anterior teeth have blank developmental lobes. Anybody want to tell me?
Is it 3?
Yes, it is 3 developmental lobes. And actually, wait, no, it's 4 because 1 on the lingual, 3 on the front, 1 on the lingual. So it's 4, and are viewed and are blank when viewed from either proximal surface. Are they trapezoidal or are they triangular?
Triangular?
Yes. Okay. Yeah, I tend to forget about that cusp of care. I mean, that cingulum back there, because you have the 3 lobes on the front, but you have that 4th lobe on the lingual. The function of permanent incisors, I think we talked about that the other day, are for biting and tearing, grinding and cutting, biting and cutting, or tearing and grinding.
Isn't it? Wait, can you read it again?
Yes. Function of permanent incisors: biting and tearing, grinding and cutting, biting and cutting, or tearing and grinding.
Biting and cutting.
Yes, biting and cutting. Yeah, because tearing is more of the
Like canine, right?
yeah. I'm the one thing I love about this book is it always gives a great explanation on why we said this. Number 28. No, yeah, 28. Yeah, it's biting and cutting food for mastication because the incisal ridge is not. It's not. I mean, biting and cutting because it's not tearing with the puncturing and the tearing of the canine. How many triangular grooves are present on the permanent maxillary first molar? Primary maxillary first molar. Triangular grooves. I've got to look at the. There are 3. One from the mesiobuccal groove, one from the mesiolingual triangular groove, and then the distal buccal triangular groove.
Did you say the permanent first molar?
Yes,
or
permanent first. Yeah. I wonder if I even, I'm like, I wonder if I even put chapter 18 on this, because this is my, nope, I sure did not. Know your sides of the teeth, making sure that you know that the mesial is closest to the midline, distal is furthest away from the midline. The longest tooth in the mandibular arch of the permanent dentition is the mandibular
Canine.
Yep. That is correct. Oh, where's that one? The universal. Okay, 21. Yeah, so there might be a couple of like, because just to make sure that you know the names of the teeth, there'll be a couple of those questions on there, and I'll make it. Which of the following is the tooth designation system that uses 1 through 32?
Universal.
Universal. And for Palmer, it would say uses a bracket with the tooth number in it. And then international would be the first number is the number of the quadrant and the second number is the number of the tooth. Okay. If you know, and I've said this before, if you can do, when you're studying, if you do your look at your learning objectives and you can answer, each one has like 10. If you can answer all of those questions, you should be able to do well on the test. So that's one way to study. If you can answer those objective questions. So if you can answer them, read it, look over them, answer them, you should be fine. Any more questions before I let you guys go for the evening? No? Okay.
I do. It's just not about this test. So obviously this one's 50 questions, but is the final going to be 50 questions or more? Because
It's going to be about 150 questions.
okay.
Yeah.
Just curious.
It's it's a not going to be, it's heavily weighted, but it's also not going to be, you're going to have a lot more room. It's going to be somewhere between 150 and 200 questions. So it's 16 chapters or 20 chapters. I mean, it's, yeah. So, and I mean, if I think about it, every test has been 50 and we have 4, we'll have 4 tests. So that's solid 200 questions right there. And then I've got to throw in the 19 and 20 about occlusion. Yeah. So, but I will, because I didn't record the molar, I'll just make a quick recording and send that out to you guys. Might not get to you Friday until Friday. Friday's my next day. And then Saturday, I'm in the clinic all day with the 21s. So they're taking my weekend. Yes, I said it. No, I enjoy being, I enjoy being in the clinic for those classes, for those working hands-on. I'm a lot better hands-on than I am up here reading from slides. So, yeah, so much bigger test. So sorry. It's good and bad. But.
That's okay. Are you able to post the slides that we went over today?
Yes, I am. I'm going to. Yeah. Yeah. With the, after I upload the recording to YouTube, I'll go ahead and